Why is stress incontinence so common across all ages? Imagine laughing so hard you accidentally leak a little urine. That's a simple example of stress incontinence, a condition that affects many people at different stages of life. It's surprisingly common across all ages because it happens when the muscles and tissues supporting the bladder and urethra weaken or don't work properly. These support structures are essential for keeping urine in until you choose to go. When they become less effective, even normal activities like coughing, sneezing, or exercising can cause involuntary leakage. One of the main reasons stress incontinence is so widespread is because of changes in anatomy and physiology. The pelvic floor muscles and connective tissues hold the bladder in place and help control urine flow. If these muscles are damaged or weakened, the urethral sphincter cannot stay closed under pressure. This weakening can happen from many causes, including childbirth, surgeries, hormonal shifts, or injuries, and these factors can affect people of all ages. Pregnancy and vaginal childbirth are major contributors, especially for women of reproductive age. During delivery, the physical strain and potential nerve or muscle damage can impair pelvic floor function, increasing the risk of stress incontinence even in younger women. Hormonal changes, particularly the drop in estrogen levels during menopause, also play a role. Estrogen helps maintain tissue elasticity and strength, so when levels decrease, tissues become thinner and less supportive, making stress incontinence more common in middle-aged and older women. However, hormonal imbalances in younger women can also contribute. As people age, natural muscle loss and changes in connective tissue and nerve function can weaken the pelvic support structures. Although urge incontinence tends to increase with age, stress incontinence remains prevalent because of these degenerative changes. Lifestyle factors also matter. Obesity, chronic coughing from lung diseases or smoking, heavy physical work, and repeated straining from constipation all increase abdominal pressure, putting extra stress on the bladder and supporting tissues at any age. Gender differences are important too. Women are more prone to stress incontinence because of their anatomy, such as a shorter urethra, and the effects of pregnancy and childbirth. Men can also experience stress incontinence, especially after prostate surgery or as muscles weaken with age. Studies show that a significant number of women across different ages experience some form of urinary leakage, with estimates ranging from about 29% to 75%. While the exact prevalence can vary, stress incontinence remains a common issue throughout adult life. From a bladder health perspective, stress incontinence reflects a failure of the bladder outlet to stay closed when abdominal pressure increases. It's influenced by many factors that change over a person's lifetime, including hormonal shifts, physical activity, and aging. Although stress incontinence is not directly linked to bladder cancer, ongoing bladder irritation or infections associated with incontinence should be checked by healthcare professionals to keep your bladder healthy. In summary, stress incontinence is so common across all ages because it results from a complex interplay of anatomical, hormonal, lifestyle, and age-related factors that weaken the support structures of the bladder and urethra. Managing it often involves pelvic floor exercises, lifestyle changes, and medical or surgical options tailored to each person's age and health. If you experience symptoms, it's always best to consult a healthcare provider for personalized advice and treatment options.